Hey, it's Dr. Cody Arrell with Stanford Brainstorm. Today we have an interview and pitch with Dr. Doris Rusch. This is an associate professor of game design at DePaul University. Dr. Rusch wants to design an anxiety-conquering evidence-based game called Soteria VR. Good afternoon.
Hello.
I'm with Doris from Soteria. Did I say it right? Soteria?
Soteria. Soteria VR.
Is it S-O-L or S-O-R?
With a T and an R. Soteria.
Soteria.
Mm-hmm.
Okay.
The goddess of safety.
Is it really?
Yes.
It makes sense because your app or your VR is anxiety based.
It's almost like we thought about it.
It's almost like you thought about it. I'm with Doris from Soteria. Thank you so much for being with me today. So we just did the innovation lab with Brainstorm. How did it go for you?
It was a very thrilling and enriching experience. We got a bunch of feedback from people who have a background in law, and business, and experience design, and IP, and all sorts of other things. So it was really exciting to see how they were buying into the idea and what perspectives they brought to the table to make us think harder, more critical, and more informed about all the choices we have to make.
That's awesome. And can you talk a little bit about what your platform is? It's a virtual reality platform, right?
Yes. So the game will be developed for PC, will be played while seated, and you use the Oculus Touch to be immersed in that environment, and the touch controls to have a more natural interaction with the environment.
And so you had a lot of choices to make, you said. Is there a particular direction that you guys were headed that maybe this conference has helped you think about other directions to head?
Yeah, I think the most important choice for us is how we are going to prove the financial viability of this, because I'm a game designer and I have a more, idealistic approach to all of this, or I just want to make stuff that is cool and useful.
Yeah.
And I never put on the business head because I don't have to. I work at a university.
Okay, yeah.
And so this is why the choice between, are we going for the health system, are we going for individual providers, are we releasing this as a standalone on a gaming platform so people can access this who might not have access to mental health resources otherwise. These are some really tough choices to make.
Yeah, I think that what was interesting about this lab from ones that we've done previously is that there was a lot of real talk almost. It was like, making sure you got your patents right, the law side of things. And so you mentioned that you guys did get a good advice from a lawyer, which I think is interesting. But anything else that came up in the conference that you felt like was helpful?
I mean, what is incredibly helpful is you have this idea, and then you work on it and you do test it and you get feedback, but you're so in love with your darling, right? Because it's the thing. And getting feedback from people who have absolutely no stake in it, who have not been part of the conception of this, who might maybe buy to a small percentage into the passion, but everybody's passionate about their thing, right?
Yeah, sure.
That meant a whole lot and it was very encouraging. And I think this is something that will help us come back to when we are having trouble maybe and find the motivation to see it through.
Yeah, that's awesome. I really wish you guys luck moving forward. And you're based in Chicago, right?
Yes.
Is there somewhere that people can find out more about what you guys are doing specifically?
Absolutely.
Online?
So I'm a professor at DePaul University, the College of Computing and Digital Media, and I do have my own lab. For now, it is called the Play for Change Lab, but we're going to change the name to Deep Games Lab.
Okay.
So if people go to the website, just Google me.
Yeah, all right.
We have all the games free online. There's a lot of mental health stuff and other games as well. And Soteria, the proof of concept, is on there too with some background information. The game is free to play for now, so
awesome.
The original. So yeah, everybody can go there and find out more.
Great. If you guys have questions, you can leave comments on the video. Go to the website, check out the content. Thank you so much, Doris, for talking with me today.
It's a pleasure.
It was really fun.
Thank you, Cody.
Thanks.
Good morning. So I'm Doris Rusch. I'm an associate professor for game design at DePaul University. This is my research partner, Susan Rivers from I Thrive Games. She will also be here to answer tricky questions. So anxiety is a real problem, as we've heard, but also beyond the dentist's office. And one of the problems is that a lot of people do not go seek treatment. Treatment can be lengthy, and it can also lack effectiveness. I know anxiety up close and personal from my family, and I believe we owe it to our kids to not submit to it, but really stand up to it. So we are proposing
an anxiety-conquering, evidence-based VR game called Soteria VR. We are targeting outpatients, anxiety patients and outpatient care, and we have access to the Centerstone Research Health System, where we could reach 172,000 patients annually. There are a ton of anxiety apps out there, admittedly, like Breathe to Calm and Calmness and Breathe to Relax and all of these good things, and there is evidence that they are helpful, yet they're buying exactly into the rhetoric that keeps anxiety alive, namely that safety is the desired state. You want to feel calm all the time. This is exactly what we need to work against if we want to overcome anxiety. And we are basing this on leading anxiety researchers' research, Reed Wilson's and Jennifer Blackford's at Vanderbilt University, who say, if you really want to rob anxiety of its power, you've got to move towards the roar. I see nods, that's nice. So this is exactly what we are proposing with Soteria VR. We are taking these counterintuitive strategies and we are modeling these strategies in the game where players learn how to deal with anxiety by facing it head on. We already have a proof of concept. This is a PC game I developed with a team of students at DePaul University over 2 years. We tested that, it won awards. But it is on the flat screen, so virtual reality can increase the embodied experience of this, make it much more intense, and thus also increase the visual and physical memory of the learning. It is incredibly hard for anxiety patients or anybody to really face their fears, so we are choosing a metaphorical approach where we transport people into a magical place where they can confront something that otherwise might be too close for comfort. And then they learn the tools, how to face it. And with that embodied experience of empowerment, you're sending them back into the real world and say, here, you did it there, you can do it here. So you're creating this bridge. They're using, obviously, VR, Oculus Touch, to increase this kind of presence and the touch controls to have a very natural way to engage with the environment. We're using, these slides are all messed up, we're using cutting-edge measuring techniques with our partners at Vanderbilt University, fMRI, psychophysiological measuring of effectiveness, and then of course including the standard surveys, interviews, observations, all of that. We have access to the dissemination network of Centerstone Research. They have 230 facilities in 5 different states, 5,000 staff members, and as I said before, they serve 172,000 patients a year. We are developing this project not with students, but with a professional development company, Casarar. They're Montreal-based, and they have a proven track record not only of creating impactful VR games, but also tackling challenging emotional projects by repackaging them, like alcoholism and bullying in Papai'o and Spirits of Spring, so they know what they're doing. We are at the point right now where we have to raise funds for Soteria VR as this one flagship project, but then our real goal is to release a suite of games, VR games, that could tackle a range of different mental health issues. We are looking at a 7-month development timeline for this. We already figured this out somehow. So we want Centerstone to fund the project, release it into their system for free so we can collect the data, then fundraise extensively to build the whole suite of games and plan for a national rollout. I think what we're bringing together is cutting-edge evidence-based anxiety research. Emotionally compelling metaphorical game design, and VR technology. We have the perfect development partners, we have the perfect dissemination infrastructure, and we have assessment experts that we can collaborate with. And I think with this innovation, we can stimulate a very new way for patients and therapists to engage very challenging behavioral mental health issues and help patients to move towards the roar. Thank you.
Doris, lovely delivery. Thank you very much. So one question is, I didn't really get a sense of your business model, specifically once you get, I heard you talk about development and getting to that place, and you develop a suite of products. Once you get there, who is your target customer exactly? How much are you charging them? And why are they choosing you over someone else?
Right. So we had a lot of discussions about this. Obviously, this is still in development. we played around with different models where we would go for licensing. So we would still target facilities because we want to reach patients in outpatient care, and then we would license the game to these facilities. But obviously this is something that we were hoping to also get feedback on.
Right, and so why are facilities financially incentivized to do this?
Because, for the same argument as before, it will be treatment effectiveness increasing, and people will come back. They will go to treatment, they will come back to treatment, they will not have to stay in treatment as long. So there are a lot of advantages to do this.
I would think more about that during the
Absolutely.
Yeah. And how you sell to insurance companies and how you sell to providers and how that all factors in.
Yeah.
Thank you, Doris. I'd love to hear a little bit more about your, in terms of the partnerships with the content company that you're partnering with. What's the relationship going to look like over the long term? How would you envision it playing out over time? I know a lot of times the content development companies will either do flat fee up front, or they may want to take a percentage of revenue. And thinking about ongoing maintenance after you learn from the initial MVP. How do you see working with them?
Yeah. So that's also something that we need to negotiate with them. For now, our agreement is that they are going to get the production of the game funded, and then they can get a percentage when we sell it. But the IP would probably rest with iThrive Games. That's what we discussed so far. And then when we have evidence and there is a demand for more, then we would negotiate a new contract with them for the suite of VR games.
Okay. And do you know what that percentage is up front, or?
No.
Okay.
Thank you, Doris. I just had a quick question about just the clinical development of your product. Anxiety is kind of a large area. Are there any kind of particular kind of domains with anxiety that you guys have thought of that might make a...
Thank you for this question, because this is one that I feel comfortable answering. We are choosing a metaphorical approach to this, so we can actually tackle a range of anxiety disorders. This is about facing your fears, not facing a fear of something specific. So by being put in a situation where you at first feel really vulnerable towards that fear that's coming towards you, and then learning how to really provoke it and linger through it, which is what we did in our prototype, and we got responses from anxiety patients across a different range of anxiety disorders. This in and of itself is really effective. So we don't have to target social anxiety or germophobia or fear of flying or whatever it is, because it's about the underlying belief system. That is what we're modeling. And the proof of concept was developed with a subject matter expert, which is Reed Wilson, which is a leading anxiety researcher. So all of this was developed with him from conception of idea to implementation, throughout involved in the process.
Hi, Doris. Thank you. So one quick question about the evidence base. And oftentimes with technology, we're referring to evidence-based treatments like CBT, or we're gamifying it or putting it up. And then apparently is no longer evidence-based. It needs to be reestablished. I may have missed this, but what about plans for doing a trial, the more of the evidence-based side, in addition to the game development?
Yes, so we would do a whole year of testing. We would develop it, and then we would release it for free into Centerstone, and then we would dedicate a whole year with our partners at Vanderbilt University to really thoroughly test what does it do for patients, and is it really, really helping the way we envision it, and we have evidence to believe right now that it does.
As a formal clinical trial?
Yes.
Okay.
And I think we had one audience question that we wanted to.
Yeah. Obviously, we're doing a tremendous amount of work trying to develop this innovative kind of approach to the game. However, as a child psychiatrist, I'm wondering whether you take into consideration the developmental age of the child. In other words, at this point, the anxiety disorder is such a broad subject, and particularly early childhood.
Yes.
It's for me, it's conceivable to use that, but I'm wondering what kind of consideration you're giving in terms of the developmental stages.
Sure, that's a great question. So when we originally conceived of this project, it was for adolescents and young adults. We did not really target this for children. This is outside of what I feel comfortable doing. So this would be targeted at older patients.
Adolescent, what age range?
From starting with pre-adolescence, 12. Yeah.
Upward.
Yes, upward.
Okay.
Thank you so much. Thank you so much.